Good day. My name is Jason Winters, Critical Care Paramedic for Keystone Quality Transport. I've worked with many of you over the years, and I've been asked to give you some simplified information about COVID-19 and how to prevent it, as well as what to do in the case of getting it. Now, what is important about this disease? Well, there are two reactions we can have to this disease. The first being anger, which leads us to believe that these people are to be mistrusted or feared. And the second is to feel empowered in our knowledge. We should never fear these people, as they are not our enemy. The disease is our enemy, not the person. We have been dealing with this disease for approximately 3 or 4 months now, and we have gathered a lot of knowledge and understanding about it. And this will continue to grow every day. Our clinical director, Mike Moretti, spends his time not only just helping us plan for our next move in dealing with COVID-19, but he has also immersed himself in finding out what doctors, CDC, and the World Health Organization are publishing about this disease. We should not be scared. We're growing in our knowledge every day. What exactly is COVID-19? Well, it's the name we've given to the disease known as coronavirus disease 2019. First discovered in the Wuhan region of China, where it was most likely made the jump from an animal such as a bat or a pangolin to humans. Now, many of us have seen the term SARS-CoV-2. This is the virus that causes COVID-19. Simple way to think about this is to look at it as though it's AIDS and HIV. HIV being the virus and AIDS being the disease. COVID-19 comes from the family of viruses that cause the common cold. There are approximately 25% of all common cold viruses are made up of coronaviruses. Now, what makes COVID-19 different than the other coronaviruses that we deal with is that this one is a novel virus. Just means, quite simply, that we as humans have never seen it before and therefore have no immunity to the disease. Now, COVID-19 or SARS-CoV-2, when compared to other viruses, it's quite simply a weak, kind of easily defeated disease, which is killed very easily with disinfectants, hand sanitizer, and good hand washing. Now, there is a little scary part to this, and that is that we can easily get it and spread it. However, this doesn't occur as easily as you're led to believe by some people. It often requires sustained contact with somebody with the disease, or you've infected yourself by touching your hands to your face or placing them in your mouth. What does the virus look like? Coronavirus is Latin for crown. So, if we were to draw it out on a piece of paper, it would look like a circle surrounded by many sockets. But this really means nothing to us. So we're not going to see the virus itself, but rather we're going to see the symptoms and how they manifest in our patients. So what should we be looking for? Simply a cough with a fever, possible shortness of breath, body aches. Sound familiar? Approximately 80% will have just a fever, headache, mild cough, not feel very good. Generally about 3 to 5 days. Disease has a typical lasting period of approximately 5 to 7, or in the case of a severe infection, 14 days. Mild cases usually begin to feel better within 3 to 5 days. However, in your more moderate to severe cases, where shortness of breath can begin around day 5 to 7, and then they begin to feel on the mend by day 7. How do we get the disease? We, as I mentioned earlier, can get it one of 2 ways. First, with sustained contact with someone who has the disease. This would be about 30 minutes or longer without any PPE, or being around somebody who we don't suspect of having it, but be on the verge of developing symptoms. Again, without PPE or good hand hygiene. The second method of contracting the disease is by self-infection. This would be by touching a contaminated surface and then touching your face, your eyes, your nose, putting your fingers in your mouth. All fairly common things that most of us do unconsciously. Now, there is a belief that the disease can be aerosolized. However, the evidence suggests this still requires some sustained contact, usually about 15 to 30 minutes without you or the person wearing a mask at a minimum. So far, the most commonly reported cases have all been through self-infection. How do we protect ourselves? We need to know that this is now in every community and there's no way to truly avoid COVID-19. However, you should not be scared to live your lives. The best method of prevention is to become mentally aware of your hands and keep them virus-free. With good hand washing or the usage of Purell. Important, keep those hands clean. Again, this is how most have been infected. Next, we need to get into the habit of wearing a mask. This does not require you to wear a medical grade surgical mask or N95, but rather something that makes you aware of touching your face. This can bring attention to your conscious mind to not touch your face. This would be in a social setting such as when you're not working. Now, on the job, such as when dealing with patients, you should always be wearing a N95 that you're suspicious of or confirmed COVID-19 positive. You can also wash your hands and begin finding other methods of interacting with the environment, such as when you get into the elevator, using your elbow to push the button or having a dedicated pen to just interact with the buttons for you. You also need to wash your hands every time that you have it. Good amount is a minimum 20 times a day. You should easily be able to double that or triple that with the amount of patients that you deal with. Wearing your gloves throughout the day is a bad thing because you're not going to be, these gloves become just as contaminated and dirty as your hands do. You need to be aware of this fact and change your gloves very frequently if you're going to do this, which under the current situation where we're limited to gloves and have to resort to rationing, this isn't a good option. So Purell and hand washing are the optimum things. You should always be, if you touch something with your bare hand, you should be Purelling it afterwards. Finally, the last way to prevent yourself from getting this disease is to shrink your social circle. This means just limiting how many people you see in a day, limiting this down to the patients that you have to deal with, your partner, and the family members that rely on you. Social media such as FaceTime, Facebook, and other social media sites should become a good friend to you right about now, and dealing with the people that you don't have to see on a daily basis outside of your job or family that depend on you. What we found is that those who continue to live their lives in large social settings and gatherings are developing this disease much faster than anyone else. So in conclusion, we need to wash our hands. Use Purell when we don't have the ability to wash our hands. And find alternate ways to interact with the environment other than using your hands to interact with them. Finally, we can stop touching our face. Just be aware of this. Your face, this is how you're going to self-inflict. In fact, is to continue touching your face with contaminated hands. What do we do when we get the disease? Understand that most of the people who have gotten the disease have gotten it from their friends and family. First, you will develop a fever, kind of feel okay. If you can, you should self-isolate yourself to a private room, and possibly a private bathroom. This is a luxury not all of us can afford. However, if you can do it, do it. If you're unable to do this, just be mindful of the contact you make with surfaces as well as people, and wash your hands as frequently as you can while wearing a mask at all times, N95 or surgical being preferred. Anything that you touch should be cleaned immediately and disinfected with a surface cleaner such as Lysol or other mild detergents. Your family should distance themselves from you for the duration of the illness. This means that you should become self-reliant. Instead of having somebody check your temperature, you check your temperature. Food can be delivered to you, and you can at the door. You can get it as after the person has left. When you do interact with people, you and they should be wearing masks. Remember, most people have just developed a fever, cough, body aches, and generally feel terrible for about 5 to 7 days. Then they start to feel better between day 5 and 7. You should stay vigilant for worsening symptoms, and if shortness of breath does develop, you need to go to the hospital. Once you begin to feel better, the CDC recommends that you should wear a mask and return to your normal daily life and continue to face vigilance, as well as good hand hygiene. The true danger of this illness is being too cavalier, too flippant. If you have a fever, then take several days to see how it develops. If it goes away, wear a mask, stay vigilant. Keep an eye out for the symptoms returning or for you to begin to feel worse. If it worsens, then enact these safeguards. Shortness of breath, again, develops. Get to the hospital immediately. This is not something where we want to play games and wait for it to worsen. The next item for discussion is, if I get COVID-19 and shortness of breath, will I die? Well, this is a complex topic, and I can only fall back on the statistics right now. However, the many who do develop shortness of breath do not die because they got to the hospital in time. Those that have died often have delayed going to the hospital when they began to develop shortness of breath. This is very important and something you should not worry about. Again, the vast majority are being sent home from the hospital because they have not developed shortness of breath. Of those who do go to the hospital, approximately 10% need to go to the hospital. And of those 10%, only 1 to 3% are being admitted to the ICU to be put on a ventilator. The overwhelming majority of people on a vent do come off the vent approximately 7 to 10 days after being started on the ventilator. Finally, this is just to let you know that if you go to the hospital, you will be safe. Should you get tested? This depends on the availability of testing, and in this area, it's very common. However, if you do this, you need to let your manager know immediately. It should not be done, truly, unless you have developed some, at minimum, one of these symptoms. However, many will not develop anything worse than the common cold symptoms and not need to be tested, not need to be admitted to the hospital. If you do get tested and are negative, great news. You can return to your normal life once you feel better. If you test positive, remember to self-isolate and stay vigilant for improving or worsening symptoms and act accordingly. This brings us to the conclusion of this video and the key points we need to be aware of. First, there is to be vigilant of the common cold. This is really a variant of the common cold, and we should not live in fear of it. 2, stay vigilant of your hands and where they are going. 3rd, wash your hands, you filthy animals. Just a little levity to cut through some of the seriousness we're going through right now. 4th, wear a mask to train yourself to avoid touching your face. 5, shrink those social circles. 6th, wear an N95 when you have to deal with anybody that you suspect or know has COVID-19. 7th, if you do get sick, self-isolate and avoid contact with any family members. 8, if you develop shortness of breath, go to the hospital immediately. This one I cannot stress high enough. And finally, you're going to survive this. I've been Jason Winters, Critical Care Paramedic for Keystone Quality Transport, and I thank you for watching this video. If you have any questions, please see me, your base manager, Brian Eberly, our Safety and Risk Management, or finally, Clinical Director Mike Moretti here at Keystone Quality Transport as your last resort. Thank you and have a good day.